I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. Congresswoman Debbie Wasserman Schulz is questioning centered around Medicaid coverage and the opioid epidemic. She pointed to data that says states with expanded Medicaid coverage have seen less overdoses from opioids. The Florida Democrat asked point blank, quote, "How would further Medicaid expansion combat the opioid epidemic?" Watch how the director of the White House Office of National Drug Control Policy responded.
Thank you, Madam Chair. And thank you, Director Gupta, for your testimony and for the work of your office, as well as the Biden-Harris administration's effort to combat this crisis. And let me just state for the record that your efforts are the furthest thing from not understanding what the crisis is. And in my experience with you and the conversations I've had with you, it's very clear to me that you understand the depth of the crisis, and also clear to me that immigration policy and border policy is not in your job description. So our colleagues on the other side of the aisle in this committee talk a lot, a good game about focusing on what we are actually responsible for. That policy is not what we're responsible for in the Oversight Committee. But I do want to talk about an issue that directly affects my home state of Florida and any of the deadly dozen states that have an expanded Medicaid, how inadequate health insurance coverage contributes to our nation's addiction and overdose crisis. Research shows that overdose rates are lower in states that expanded Medicaid coverage under the Affordable Care Act. In fact, states that expanded Medicaid coverage experience at least 10% fewer overdoses involving synthetic opioids like fentanyl and 11% fewer overdoses involving heroin when compared against states that haven't expanded Medicaid. So, Director Gupta, how would further Medicaid expansion combat the opioid epidemic and improve access to treatment and recovery for individuals experiencing substance use disorder?
Thank you, Congresswoman, and I really appreciate the efforts and the fact that we were able to see some offloads once again of being the interdiction aspect is so important.
Yes.
The treatment part is so critical because as we try to get people to help, one of the reasons people do not get the help is because they don't have the coverage and they can't afford. And very people that we're trying to help often cannot afford to see a physician or a provider. And that's tragic and that's unfortunate. So we know that there is a direct link between increasing access to care and getting actually the care. And it's critical. That's probably one of the most important pieces of the backbone that we're going to need to solve this crisis and save the 107,000 lives or perhaps increasing number in the future. So access to care is a critical component. And obviously, people who get it are able to then have at least one more issue that they don't have to worry about while seeking care.
Absolutely. Thank you. And I mean, we're all painfully aware of how the addiction and overdose crisis has impacted our nation's young people. In fact, the final 2 years of the Trump administration, the overdose mortality rate among U.S. adolescents went up 94%. And this crisis also affects young adults, especially those who may struggle to find adequate health insurance. And let me tell you, you and I together saw firsthand the efforts that are being made with an entire deck full of interdicted drugs in South Florida that were brought in, among the largest interdictions of drugs in our history that the Coast Guard was able to recover, and you and I were there to witness it. So any suggestion that there isn't every effort being made for to interdict the importation of the smuggling of illicit drugs is erroneous. So I want to also just focus on Medicaid expansion and how it would help young adults acquire health insurance. How would increased access to health insurance lead to access to effective treatment and recovery, and thus improved outcomes for young adults and for society generally? I mean, again, we have 12 states in the country, mine included, that have not expanded Medicaid. And as a result, the rate of drug overdose is higher in those states than it is in those states that have expanded Medicaid.
Thank you, Congresswoman. First of all, it's important to note that about half of the people with substance use disorder have mental health and vice versa. So there's overlap between mental health that also is part of the importance of access to care. It is true and tragic that young people are perishing at a higher rate than ever before because of the overlap of the two. It's also true that majority of people of the 107,000 deaths that happen are between 25 and 54 years of age. That means that's a working age population across this country that we're losing 100,000 people at a time every year. So if you think about it from economics, if you think about it common sense, if you think about it from the ability to get people the ability to feel that they can get help and overlap, it's critical.
It's basic math. Really, what it boils down to is if you have health insurance, if you can afford to pay for your health care, you are much more likely to be able to get access to that care and prevent your from ever being addicted to drugs in the first place and be able to overcome substance use disorder in the second place. So I appreciate your explanation of how expanding Medicaid is absolutely vital in our fight against this terrible crisis. The Affordable Care Act provides a powerful tool to fight addiction and overdoses, yet Republicans like Florida Governor Ron DeSantis refuse to expand Medicaid to reduce the misery and death that this disease brings on. Sadly, because Governor DeSantis is immune to facts, science, and even the shame of adding to the overwhelming grief that families must endure because of his callous inaction, he is not likely to be moved to act. But that doesn't mean we stop calling out his and other Republican governors' cruel indifference and how it compounds this crisis and adds to the pain that millions of American families will suffer. Thank you, Madam Chair. I yield back the balance of my time. And Dr. Gupta, thank you so much for your service.
Thank you.